We're standing in the microbiology laboratory, and here we are running COVID or SARS-CoV-2 tests. Our mission here at Children's National is to take care of our patients and the local and regional and every other child that we possibly can. And right now we are meeting our mission, but are constrained by how many tests we can run by the supplies that are available to us. We have the staff and we have the equipment, and so if we were able to get more supplies, then we could run 1,000 or more a day and be able to meet the demand both of our patients and then of the broader community as well. This machine here, if we were to dedicate it to COVID testing, we could run over 1,000 samples a day. And this machine over here, if we were to dedicate it to COVID testing, then we could run hundreds of samples on this machine a day. So what is the problem right now is that we don't have the supplies that we need to run these instruments for the COVID test. Right now, today, I have no COVID test supplies for this machine, and for this machine, I have about 50. A positive result for coronavirus is really important to know for patients because we want to make sure that we identify them and care for them appropriately, but also to protect our healthcare workers. We can do the testing very quickly. The belt and suspenders approach is that there's also some laboratories that can do lots of high volume, and the downside of those is often you have to wait longer for the results. Having fast turnaround time testing available here at the hospital has helped us rapidly identify positive healthcare workers and isolate them. We did have a healthcare worker that was found to be infected with coronavirus. We detected that result using our machine and were able to identify and leap into action right away after we got that result back in 90 minutes. I don't think that there is one test that can solve the pandemic. Unfortunately, there's no magic bullet. Again, the idea of belt and suspenders, the laboratories with the capabilities to run different tests at the same time for coronavirus, I think is the answer, because then we can all get supplies from each of the companies and run all of the tests to try to collectively increase the capacity for testing.